Hey, Robert Santana here with another short science video to help you better understand and treat acne. So today we're going to look at what different severities of acne look like and how many people are affected by mild, moderate, and severe acne. I think it's valuable to get a perspective and know where you are at with your acne in relation to other patients. For some, it might show you that things are not that bad and that others might suffer even more from acne. At least for me, that was somewhat of a helpful realization. Knowing how many other people are affected by the same level of acne might also show you that you are not alone with this and that others share the same problems that you have. And finally, of course, this is also valuable for treatments of acne. What treatment is appropriate for which stage of acne? When are you at risk for scarring and other sequelae of acne? Besides all that, a CLIA grading system for acne is also very important for medical research. Say, for example, you want to know if a drug improves acne or if people of different parts of the world have different rates of acne. To compare before and after changes or to compare different populations to one another, you must have a reliable grading system to easily describe acne severity. And just as important to compare different studies with one another, say one study looking at acne rates in China and another one looking at acne rates in the US, you ideally want a globally accepted, universally used acne grading system. As it turns out, though, this does not exist, which hinders the research, and scientists complained about it in 1997 and still complain about it almost 20 years later. There are several grading systems that are used, one of them being the Leeds acne grading technique. This grading system uses 12 categories for facial acne and 8 for acne on the chest and the back, allowing for quite fine distinctions. Now, I'm not going to bore you with all the details, but basically as we go from very mild or moderate to very severe acne, we see that it starts off with just a few open and closed comedones and very little inflammation with the occasional small pustule. As we then move towards moderate acne, we see ever increasing amounts of inflammation in the form of pustules and papules, in addition to the comedones. Severe acne is then characterized by additional larger, deeper, and more painful inflammatory lesions called nodules that form large bumps under the skin. We also often hear about cysts in this context, but technically cysts are quite rare in acne, and most cysts are actually nodules. Here we can see the progression for acne on the chest, and here for acne on the back. Now, the Leeds acne grading technique also rates different severities of non-inflamed acne that consists primarily of open and closed comedones. But what do all these terms like comedo, papule, pustule, and nodule mean exactly? As if it wasn't confusing enough, these terms are not always used consistently, but here's a typical breakdown. A comedo is a skin pore, or more precisely a hair follicle, that is clogged with excess sebum, skin material, and possibly bacteria. If the clogged sebum remains under the skin surface, it is a closed comedo, also called whitehead. If the sebum reaches the skin surface and comes into contact with oxygen, the lipids in the sebum oxidize and turn dark. This is an open comedo, also called blackhead. These are usually non-inflamed symptoms. If the follicle wall of a comedo ruptures and gets inflamed and possibly forms pus, we call it a papule as long as the pus hasn't reached the skin surface yet. Papules are small, red, sensitive bumps under the skin. When the pus of a papule reaches the skin surface, we call it a pustule. If a papule becomes very large, deep, and painful, we call it a nodule. These nodules can grow together and form even larger painful bumps. And this very severe form of nodular acne is then called acne conglobata. Let's talk about treatment very briefly. In general, acne should, in my opinion, always be treated from multiple angles to be most effective. This includes diet and lifestyle as a basis, which might already be enough for many patients. On top come supplements and over-the-counter skincare. These can have tremendous effects without strong side effects. And finally, proper medication, which is especially crucial for more severe cases of acne, should be utilized quickly to minimize scarring and psychological problems, which are both common and serious sequelae of severe acne. On top of that, psychological counseling for patients with severe acne is also sensible. I'll not go into detail about all the treatment methods here, but you can find my complete recommendations on diet, skincare, supplements, and medications in this video series. Now, you might think, my acne looks like the one on this or that picture, and you might wonder how many other people suffer from that degree of acne. Now, the total amount of people suffering from acne is very high. Depending on the age, about 70 to close to 100% of teenagers over 12 years of age suffer from acne in most countries. In the 20s, about half of people are still affected by acne. Most studies show that about 2/3 of acne patients are affected by mild acne, and about 1/3 of acne patients are affected by moderate acne. Severe acne is very rare and accounts for less than 10% of acne patients. Now, many studies only differentiate between mild, moderate, and severe acne, and oftentimes don't explain exactly what they mean by that. So now you see the problem of everyone using their own grading system. I would think that mild acne would refer to a degree of acne that we see in the photographs A through Z. Moderate acne might refer to E through G, and anything beyond that would probably be categorized as severe acne. All right, I hope that gives you a better understanding of what acne can look like and how common the different types of acne are. If you have any questions regarding acne, please post them in the comments below. I'll do my best to answer them all. If there's anything you would like me to make a video about, just post it in the comments as well. Also, if you'd like to learn more about acne and get a clear roadmap on how to treat it most effectively, you can check out my book, linked in the description below, or get a personal counseling session. Thank you so much for watching. See you next time.